Hi, my name is Corey Chilberg. I'm a student at Goodwin College in leadership practices in organizational communications. I'm going to do a 5-minute talk today as I run through for my final exam. Years ago, long before I was a nurse, while in school pursuing a degree in nutrition, I stopped in to visit my mother at work. She was an administrator in a nursing home. Lunch was being served. There were sandwiches laid out. She asked if I wanted any. I remember perusing the options amongst the residents who were doing the same. White bread cut into triangles, unrecognizable mush in between, overly mayonnaised tuna and egg, no vegetables save a soggy piece of iceberg. These people are sick, I complained to my mother. Nutrition is one of the most important things you can offer them right now. Her response was dismissive. Old habits are hard to break. The elderly aren't interested in your new version of health food. New version of health food? At the time, I was encouraging my family to choose whole wheat pastas and cut down on their meat intake. Was that new? They were certainly not interested then, and they're not now. But what if research showed that a whole food, varied diet, low in saturated fats, and void of processed foods could actually slow or prevent neurological disease, like many of these elderly people were suffering from? Martha Claire Morris, a professor at Rush University, talks about 2 well-known diets that show cognitive benefits. She's designed an eating plan to preserve brain function. Among food groups, fish and vegetable consumption and a low saturated-unsaturated fat ratio have been associated with slower cognitive decline. One of the problems has to do with glucose. Glucose is the end product of carbohydrate metabolism. A healthy diet should have a lot of carbohydrates, simple carbs like an apple, and complex carbs like whole wheat bread. As we age, our neurons use less glucose, partly because the neurons are less able to process it into energy, and partly because they're programmed to need less. Either way, this results in less energy for our brain cells. This has been described as a vicious cycle of neuron exhaustion. Neurons need energy to maintain cognizance, and they need even more energy to heal if a neurological deficit is present. So, we need to eat enough of the right kind of carbs consistently for our entire lives. Malnutrition in childhood has shown a direct link to neurodegenerative diseases later in life. The diet Martha Claire Morris cites calls for 1 daily serving of green leafy vegetables, 2 of other vegetables, 1 of berries, and 3 of whole grains. Fish should be eaten at least once weekly. Consumption of olive oil, nuts, and beans is encouraged, and cheese, sweets, red meats, and fast foods minimized. Similarly, a number of well-known clinical phenomena point to the possibility that micronutrients, or the lack of, may play a role in the development of dementia. Homocysteine levels in the blood rise when there is a deficiency in B12 and folate, which is common in the elderly with cognitive decline. Also, the antioxidant vitamins C and E can positively influence the neural inflammation and oxidative damage which takes place in the development of dementia. And omega-3 fatty acids are an essential element in combating the inflammation and amyloid bundles that develop in dementia. Vitamin E deficiencies in particular, according to Rondanelli et al., need to be a leading agent for the change in the lifestyles of the elderly to prevent specific age-related pathologies. The optimum diet therapy to avoid high inflammation and oxidation, which is often the cause of age-related pathologies such as cognitive impairment, must aim at achieving specific nutrition goals, he says. Maintaining body weight and increasing their intake of all foods rich in vitamin E, derivatives of oily seeds like wheat germ oil, olive oil, nuts like hazelnuts, walnuts, and almonds, and cereals rich in vitamin E. Even after all this evidence, I wanted to hear it from a nurse. Elaine Jennings states in the Journal of Community Nursing that there is consistent evidence that adherence to a Mediterranean diet may lower the risk of cognitive decline and dementia. A 6.5-year study showed that those that adhered to a Mediterranean diet with high cereal, fruits, fish, legumes, and vegetable content, supplemented with extra virgin olive oil, had better cognitive function and less incidence of mild cognitive impair. In an effort to encourage better nutrition, she states that the mental health of patients presenting to community nurses with physical health problems should be routinely considered when deciding how best to plan care. I agree with her that regular and consistent healthy eating messages should be routinely included in holistic nursing care plans. Thanks.